Hi guys, it's Dr. Alistair McAlpine here. So a question I get asked all the time by a lot of patients is, when is it a good time to start hormone optimization therapy? So there's quite a lot to unpack in this question. There's two main things you obviously need to look at. We need to look at you as a patient, and we need to look at your biomarkers as well, so i.e. blood results. So obviously, if you feel that you've got symptoms of a hormonal imbalance or hormonal deficiency, and there can be a laundry list of those things, of sort of symptoms that you can have with that, from fatigue to lack of energy to loss of muscle mass, decreased libido, depression, anxiety, poor sleep, and the list can go on and on. Obviously, if you tick those boxes, then is a good time to potentially consider doing a blood test. So looking at the biomarkers. In the day, the blood results don't lie. Obviously, if you see that there is an imbalance or your levels are sitting low or a suboptimal level, you can obviously still have symptoms, even if you're not low, but you're suboptimal for your age. That is where optimization therapy may come into play. So obviously, it's very important this is done under medical guidance, it's done correctly, that the correct therapy is used for you as an individual. It's not a one-size-fits-all approach. It needs to be a customized and patient individual approach to ensure an optimal outcome. And this is where, check the bloods, check the biomarkers. If you see that your levels are low, do something about it. Don't wait. If you wait for too long, what's going to happen is you're not going to get that time back. It's like an investment. The earlier you start putting money into the investment, you're going to reap the rewards later on down the line. If you wait too late, you might get some rewards, but you're not going to get the full benefit. So when in doubt, check your bloods, see where you are. And there's no harm in even checking your bloods if you don't have symptoms, just to see where your levels are. And it's always good to have that baseline. Anyway, I hope you found this video to be helpful. And yeah, look for some more videos.